Hi, I'm Matt Willis, Public Health Officer from Marin County. We've been providing daily video updates of our county COVID-19 response, but I'm here to share a more personal experience from home. On Friday, I started feeling feverish with a worsening cough. I was referred to our drive-through COVID-19 testing facility, and today I was diagnosed with COVID-19. So I'm here on home quarantine as Marin's 39th confirmed case. My symptoms have actually improved somewhat since Friday. Although I still have a cough, I don't have any more fevers. I don't know where I was exposed. Monday, I was in the South Bay area for the announcement of our shelter-in-place order, and there may have been exposure in that community that has higher prevalence. My symptoms started days later. Or it may be related to the work we're doing every day with people on the front lines, our healthcare workers and emergency responders who are regularly exposed as they treat patients from our community. Either way, it's a clear sign of what we've been saying all along. I didn't necessarily think I would be such an early example of the fact that this is in our community. So here's what I'm going to do. I'm frustrated to be sidelined at this important time, but I'm part of a very large and excellent team and have the best possible Deputy Health Officer, Dr. Lisa Santora, taking over for the next few days at least. You're in excellent hands. And I can return to work according to the CDC after 3 days without symptoms. I'm hoping that time comes soon. After that, I should be more immune and can be more confident to stay active as our local incidence increases, which we know it will. So that's a small silver lining. In the meantime, I'll be quarantined for my wife and 3 kids here at home. And per CDC protocols, any workers who shared my workspace will be monitoring very closely for symptoms and will be isolated and tested if needed. We'll be following the same protocols used in hospitals to keep people protected while working on the front lines. Here's what you can do. Stay in place, shelter at home, and limit anything outside the home to only essential trips. Because we're seeing signs of our responders being exposed and pulled away from duty, we need to double down on our efforts to limit community-wide exposures. You can help us lessen the burden on our healthcare system by simply slowing the rate of spread. That we do have some control over. Today's directive to limit park use, for example, to only local access that you can walk or bike to, was taken because we're seeing large gatherings of people, even after the shelter-in-place order, driving to popular destinations and not using social distancing. We all need to take this seriously. My case is further proof that COVID-19 is with us. That story will become increasingly common. While my symptoms are now milder, as most people's will be, we also know that for many, especially our elders, the same illness can be life-threatening. That's why it's so important for us to take special care not to expose our older and other vulnerable residents. I'm so grateful for the support I've already received from my friends and family. And I want to extend that goodwill to the entire community as we weather this together.